Are you fit enough to go into labor and push? There are a lot of things we look out for before we say, okay, well, this woman, no, you might not be a candidate for labor, so let's book you for cesarean section operation, CS. Some of you are not okay. Like, you are not okay at all. This woman presented to the hospital some few months back, and she was told that her baby is too big, so there's a high possibility that the delivery will not be through the birth canal. There's a high chance that it's going to be through CS. This woman got agitated, started saying, God forbid, she's not going to have CS. She is never going to have CS. Saying a whole lot of things. So she was not welcoming to this opinion of having cesarean section. So she disappeared. She left the hospital, and only to present a few days back, and the child was already dead. So she went to a traditional birth attendant, and they tried to deliver this child through her vagina. The child got stuck. The head of the child got stuck. There's this thing called after coming head, where you have let's say the child, because of how big the child is, it was difficult for her to give birth to this child. Sorry, I'm sleepy, I'm tired, and I just have to tell you guys this before I go and change and all that. She had difficult labor, and then the child died, and then they brought her to our hospital. And this is somebody whose this child would have been alive if she had agreed for us to do CS. Now, there are some conditions your doctor will see. The way your child is placed, the way your placenta is placed. The placenta is this organ that the child gets nutrients from, the mother. Okay, so we have the mother, we have the placenta, and then the child. So basically, the placenta connects the mother with the child. The child gets nutrient from the mother through the placenta. So depending on the place the placenta is located, the size of your baby, the condition, your own overall condition as the mother, are you fit enough to go into labor and push? There are a lot of things we look out for before we say, okay, well, this woman, no, you might not be a candidate for labor, so let's book you for cesarean section operation, CS. It's not like the doctors like it, or it's just a free ticket that we give in the hospital. No, it is your own health. Are you strong enough to go through labor? Is the baby too big for your birth canal? Can the baby pass through your birth canal? Your pelvic bone, the bone where the baby passed through, that your waist area, is it big enough for a baby to pass through? Then the health of the baby. These are the things we look out for before we say, okay, this child cannot go through the birth canal. Let's tear the woman open and bring out the child. But a lot of women in Nigeria particularly, they do not want to even hear CS. They think it's not normal delivery.